Today, we're going to dive into the fundamental language of the human body. Think of it as a coordinate system, a universal GPS for the most complex and amazing machine you'll ever own, yourself. So let's jump right in. I mean, seriously, what if your body came with its own GPS? Well, in a way, it does. This anatomical language is a universal navigation system. It lets a surgeon in Tokyo and a paramedic in Toronto pinpoint the exact same location with zero ambiguity. It's an absolutely foundational concept for anyone even remotely interested in health and medicine. And this quote really gets to the heart of why this all matters so much. In medicine, close enough just doesn't cut it. Precision is everything. This shared vocabulary prevents deadly confusion and ensures everyone is on the exact same page, whether they're looking at a patient chart, reading a research paper, or working in a chaotic ER. Okay, so just like any good map, our body's GPS needs a fixed starting point, a universal true north. Without it, every direction would be relative and, honestly, just plain confusing. This foundation has a name, the anatomical position. And here it is, the anatomical position. This is our foundational concept, our starting point, a completely standardized posture from which every other location and direction is described. And listen, it doesn't matter if a patient is lying down, sitting up, or curled in a ball. In the language of anatomy, we always refer back to this one position. Now, there are some very specific rules to this position. It's not just about standing up straight and looking ahead. Your arms have to be at your sides, and here's the key detail that people often miss. The palms have to face forward, with your thumbs pointing away from the body. This very specific orientation is our map's non-negotiable default setting. So once we've established our true north, we need a compass to navigate, right? These are the directional terms that tell us where to go: up, down, left, right, front, and back, all relative to that anatomical position we just talked about. Our first pair of directions is pretty simple: front and back. Anterior, which is sometimes called ventral, means the front. Posterior, or dorsal, means the back. So, for example, your nose is anterior to the back of your head. And a fantastic way to remember dorsal is to just think of a dolphin's dorsal fin. It's always on its back. Next up, we have up and down. Superior, or cranial, means toward the head. Inferior, or caudal, means, you guessed it, away from the head. So your forehead is superior to your mouth. But here's a really important detail. These terms, superior and inferior, are primarily used when we're talking about the main axis of the body. That's your head, neck, and trunk. Okay, now let's talk about the body's center line. Imagine a line drawn right down the middle of you. Well, medial means moving toward that midline, while lateral means moving away from it. So your breastbone is medial, right in the center, while your ears are lateral to your nose. Simple as that. These next two terms are super important, and they're specifically for our limbs. Proximal means closer to where the limb attaches to the body, while distal means farther away. So your upper arm is proximal and your wrist is distal. This distinction is absolutely vital, whether a surgeon is repairing a bone or a paramedic is reporting an injury on an arm or leg. All right, we have our starting point and we have our compass. Now it's time for the final piece of our map: actually naming the landmarks. So let's take a quick tour of the major regions of the body. First off, the body is basically divided into two main territories. You've got the axial region, which is the core, the head, neck, and trunk. A great way to remember this is that an axe is used to chop the trunk of a tree. Everything else is the appendicular region. Those are your limbs or your appendages that are attached to that core. Okay, let's do a lightning round tour of the axial mainland. The whole head area, that's the cephalic region. The neck is cervical, just think of your cervical spine. Your chest is the thoracic region. Your lower back is lumbar, like the lumbar support in a good chair. And your buttocks, that's the gluteal region, home of, you guessed it, your glutes. Now for the limbs. Your upper arm is the brachial region, which is where you'll find your biceps brachii muscle. Your wrist is the carpal region. Just remember, your carpals help you drive a car. Your thigh is the femoral region, named for the femur bone. And your big toe? It's called the hallux, which you use to walk down the hall. See? Kind of fun. So let's just take a breath. We've covered the starting position, the compass directions, and the names of the major landmarks. When you put all of these pieces together, what you get is an incredibly powerful and precise system for describing the human body. And this, right here, is the ultimate takeaway. We haven't just learned a list of vocabulary words today. We've learned a living language that creates a clear, universal map of the human body. It is the absolute bedrock of safe and effective communication for every single person who works in healthcare. So now, you have the basics. You can officially read the map of the human body. The only question left is, where are you going to explore next?